So good afternoon, everybody. Gary Pace, the Public Health Officer for Lake County, and it's the Thursday, the 4th of February, 2021, and we're going to give the coronavirus update for Lake County. The brief introduction is going to be that things are a lot better right now. The number of cases is going down dramatically, and the test positivity is down, so it's all very positive developments, and Sarah will go into that data in just a moment. The hospitals are stable, and we are still in the purple tier and probably will be for at least a couple more weeks, but it's all looking much better now. So we'll let Sarah go ahead and give some of the specific data.
Great. Thank you, Dr. Pace. Okay, so this is our EPI briefing for February 4th. Like Dr. Pace said, we have some good news statewide. Here on the left, we're looking at the number of new tests reported statewide yesterday, about 168,000 new tests. That is down from our peak over the holiday season. This dark blue line is our 14-day average, so it is decreasing, but it's staying relatively high compared to the rest of the pandemic. As Dr. Pace mentioned, the testing positivity has decreased dramatically over the last couple of weeks, down from almost about 15% to 7% yesterday. That's our 14-day average. Yesterday, the state reported about 13,000 new cases for almost 3.3 million cases statewide throughout the pandemic. The good news here is with this steep increase that we experienced over the last couple months, we're seeing that steep decrease in number of new cases reported. Correspondingly, we're definitely seeing the curve start to bend downward in terms of COVID hospitalized patients statewide. So that's down to about 14,000. It was just a couple weeks ago that we were looking at almost 20,000 COVID patients were hospitalized in the state. And we're also seeing the decreased impact in our ICUs, our intensive care units. So as of yesterday, there were about 3,700 or 3,800 ICU COVID hospitalized patients. And increasingly, we have more ICU capacity as a result of fewer COVID patients in the ICU. Due to this decreased impact in our healthcare system, the regional stay-at-home order was lifted for the 3 regions that were still in it. So that was Southern California, the San Joaquin Valley, and the Bay Area. Lake County, which is in our Northern California region, was never under the stay-at-home order. And currently, or as of a couple days ago, there was about 24% remaining ICU capacity in our region and about 18% in the Bay Area and the greater Sacramento region. Here we're looking at the number of new COVID deaths statewide. And just in the last 10 days or so, we've had about 5,000 new COVID deaths in the state as COVID deaths lag from time of new infection to death. So we should hopefully start to see a decrease in this black line. As our cases are falling, we'll see new deaths decline. Every week, the state assigns a tier for the counties to indicate the level of transmission. Lake County has been in the purple tier for many weeks. The good news is that while we remain in the purple tier, which is widespread transmission, it is declining. For the week of January 17th through the 23rd, the daily case rate was about 21 per 100,000. And the testing positivity was about 7%. Both of these are declining numbers and good signs. And you can see the rest of the state, or most of the rest of the state, like Lake County, is in that purple or widespread tier. And here is our EPI curve. What this graph shows us here is the number of new cases by week. And you can see in our fall, we had a slight increase in September and then decline to a low of 21 cases the week of October 18th. And then you see our surge here in Lake County to a high of 281 cases the week after Christmas and the week of the New Year. This week here, highlighted in purple, that's the week where we've just received our new tier assignment. And then the week here, January 24th beginning January 24th, which was last week. These are the number of new cases that we've identified as of today. These will continue to increase as we receive more reports. But again, the good news is this dramatic decline over these 2 weeks. We identified 100 new cases in Lake County in the last 7 days. This is down significantly. I was reporting 250 or 300 new cases, and we have had 2 new COVID deaths in the last 7 days in Lake County for a total of 34. And lastly, just a slide on our progress in terms of vaccinations. So about 5,800 people have received at least 1 dose of the COVID vaccine. And this is about 9% of residents in the county. Thank you.
Okay, thank you, Sarah. So a couple things to point out. One is we've had about 100 new cases in the last 7 days. For us to get to the red tier, we'll need to be under 43 cases. So we're still about a little over 2 times too high, but we've dropped by almost 2/3 over the last couple weeks. So we're definitely in a rapid improvement phase right now. The other thing to notice is that we're at about 22 cases per 100,000 people. And when you're under 25 cases for 5 days in a row, the elementary schools are able to open even while we're in the purple tier. So the schools are aware of this and they're making their plans. And, I think, each school district is making their own plans and dealing with this information in their own way. But at this point, from the state point of view, by next week, the elementary schools will be able to open if the school districts are ready and put their proper plans in place and everything. So anyway, this is very exciting news, the progress that we're making, and in terms of the new cases and in terms of the transmission of the virus in the community, and we're hoping to see some benefits from that in the near future. So the main thing I want to talk about today is the vaccine and the rollout of the vaccine. This is what's gotten a lot of attention around the state and around the country. And certainly in Lake County, this is a big deal. So as Sarah pointed out, there's, now we're at over 6,000 people that have at least gotten their first dose of the vaccine. There's between 500 and 1,000, I believe, that have gotten their second dose. We're getting, the last 2 weeks, we got 800 doses of the vaccine each week. So, and then so last week and this week, we've gotten 800 each time. Next week, we should get 1,000. We are using it up as within a week of when we get it. Sutter and Adventist also are getting vaccine through their supply chains and are very actively reaching out to their patients and getting folks vaccinated as well. So that 6,000 people that have been vaccinated, that's a combination of the health department, Sutter and Adventist, and also Tribal Health, and Safeway is doing some, and a couple of the pharmacies are working through the nursing homes to do it. So it's coming in from a lot of different directions, but we're very fortunate that we're moving through as fast as we are. So just to give an update on who's getting vaccinated and who's in the tiers that can get vaccinated at this point, the phase 1A, the state guidelines have pretty much all been vaccinated. These are mainly healthcare workers, emergency medical workers, and the nursing homes. The residents in the nursing homes have all been vaccinated at this point through the pharmacy partnerships, and some of it has been through public health. The teachers and the school staff have all been offered vaccine at this point, and by the end of the week, the ones that wanted it should be vaccinated. There's been pretty good uptake, but not everybody has wanted to go forward with the vaccine, but it's something like 2/3 to 3/4 of the teachers and school staff have participated in this. We're also really focusing on the older folks, predominantly 75 and older and the ones that are particularly vulnerable, but the state allows it to be 65 and above. And so we've been doing that with the help of the senior centers, and also folks at social services and behavioral health have been helping us to contact the seniors and help them get appointments. And that's been going really well. So we plan to continue doing that moving forward. And we are also going to have some other focuses. So we'll talk about that. Just in terms of the number of the folks, the older folks in the community. So for one thing, we did the data search, and there's the 75-year-old and plus, there's a little over 5,000 people in the community. The 65 to 74-year-old, there's 9,000 people in the community. So that puts us at about 14,000 folks in this older group range. So and say maybe 2/3 of those people get it. So that's going to put us at maybe 10,000 people that we have to do. At this point, we're getting 800 doses or something, 1,000 doses a week. So it's multiple weeks to get all those folks covered. So we just encourage people to be patient, but we are moving through it. In terms of everybody that would be eligible eventually to get the vaccine, so that would be anybody 18 and older, there's something like 50,000 people in the county. So, we're at about 20% of the eligible population to get vaccinated is covered at this point. So we are making some progress. The state has really changed around their recommendations on how to prioritize people. Before, they were breaking it up into different sectors in the community, and now they're really wanting us to focus on the elders and the folks with chronic medical conditions. So the way it's going right now is we are really focusing on getting the older folks vaccinated. Soon after this, we're going to open it up to the farm worker community, some of the other essential workers, including the food service workers, and then we will open it up to folks with the chronic medical illnesses. This is based on the guidance from the state and how they're rolling it out. After that, it's probably going to be really age-based, and the older, 60 to 65-year-olds, and then the 55 to 60-year-olds, that kind of thing. But, it's very much a moving target. Right now, we are focusing on the senior population. We're finishing up with the teachers. And then in the next week or two, we're probably going to start opening it up to farm workers and food service workers and trying to get those folks in and get them going. These are the idea is we're really trying to focus on the people that have the highest risk in terms of either if they get the illness and that they may highest risk of dying, or also highest risk in terms of contact with the public. Appointments have been challenging, and I know it's been really frustrating for folks in the community that want to get a vaccine and they feel like they're in the proper tier, but they're not able to get it. We've been really focusing again on the most vulnerable. And I think we're pretty well moving through that now. So today we opened it up to the public to be able to get on to the appointment site and get an online appointment. You're only eligible at this point if you're 65 or older. But if you go to our website, the Lake County Health Department website, you can find your way to where the links are and try to get an appointment. We've only opened up the next few days, and I think they're filling up quickly. If you can't get an appointment on that line yet, just check back on Monday or so, because we're going to open it back up in a few days. We'll just go a few days at a time, because basically we don't know how much vaccine we're getting every week. And so we can only open up enough appointments that we have the vaccine coming in for. And we're basically doing this a week at a time, because that's how they allocate it to us and get us going. So basically, if you want to get an appointment and you're 65 and older, you can go to the health department website, try to connect to one of those links and see if there's any appointments left. If they're not, just check back in a couple of days, because we're just going to keep opening them up a few days at a time for a little while we're seeing how this system works. This system, the state's changing over the system completely in about a week or so. So, we're just having to walk through this a little bit at a time, because it's always changing what's given to us. If somebody's in a position where they cannot, they don't have internet access, or, an older person like my mom is not very good on the internet and she'd never be able to do it. So there is a phone number that you can try to call. This is not a number to call if you can't get an appointment, because there's no appointments available, because they don't have any extra appointments. But if you have trouble with the online platform to get your appointment, you can call this number, and it's 993-4644. 993-4644. So those are the folks that are helping mainly the older people or folks that are having trouble getting appointments because of internet problems. They can get it that way. They do not have any extra appointments. So if it's closed down online, there's no need to call them. You can also contact 211, which is, they'll have the basic vaccine information, or you can also contact our MHOAC line, which is 263-1874, or the email is MHOAC, MHOAC @lakecountyca.gov. These are all different ways to get information and to find out what you need, because we know it's just changing so fast that it's really hard to keep up with what's going on. The second doses is going well, so people are getting their second doses on time. The Moderna vaccine is what we're giving out now. The Pfizer's almost completely done. And with the Moderna vaccine, the second dose is 4 weeks after the first dose. We're trying to get people to make their appointments when they're getting their shot, but sometimes our computers aren't working. Sometimes things aren't working out the way we hope for them. If you should be getting contacted, if it's getting close to the time for a second dose, if you haven't been contacted, you can email our MHOAC line and we'll get you on the list and somebody should get in touch with you. Don't let the day go by where you think you should be getting the dose and you haven't contacted us. So the best way to do that would be through the MHOAC line, by the email probably. And so we could just compile all those and somebody will get in touch with you. So all in all, we're moving along pretty well. And I think we're looking a lot better in terms of the cases in the community, in terms of the risk. And we're pretty excited about how well the vaccine rollout's going. I know it's frustrating. People are expressing their frustration to me every day, and people feel like that the folks they're working with or somebody in their family should be at the front of the line. If it's pretty clear that you're in one of the tiers and you haven't figured out a way to get into it, you can email us at the MHOAC line, and we'll just start trying to work through those and make sure everybody that should be getting it does. Sutter and Adventists are continuing to get vaccine, and so if you're a patient with them, that might be a really good way to go, and to let our vaccine go to folks that don't have that opportunity. But all in all, we're moving along, and we're hoping this vaccine really helps out. There's two more things I wanted to mention before I sign off. One is there's this issue of the variants. There's some mutations of the virus that are starting to show up around the world. If you watch the news and you see what's happening in London or in Brazil, it can be a little scary. They seem to be more contagious and maybe more dangerous than the one that's been out. We haven't seen any of those up in Lake County. There have been some variants identified up here, but not the particularly scary ones. The ones that have shown up here, it's called the L452R is the way they are talking about it. We're not sure whether that's more contagious, where it may be a little more contagious. It doesn't seem to be more dangerous, but they're around and things are changing quickly. So really encourage people to be particularly careful with the masks and with the distancing and with not socializing outdoors and doing things like that. A lot of people are starting to recommend wearing two masks, wearing a surgical mask right close to your face and then a cloth mask over top, because there's better protection that way. I think we'll be learning more and more about that over the coming weeks. But overall, we're starting to move into a time when we're talking about when the schools can open. We're talking again about when we can get into the red zone, and we're talking about how to get vaccines to everybody. So thank you all for your cooperation and for taking care during the previous months. We're moving along pretty well, so thank you.